Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host Lee, recording from our headquarters in Stockholm, Sweden. On today's episode, we're sitting down with Andreas Hoefer, expert in microbiology and molecular epidemiology here at ECDC, as well as Rita Figuera, policy officer at the Directorate General for Health and Food Safety at the European Commission. Today we'll be discussing European Union Reference Laboratories, otherwise known as EURLs, and their role in the future of public health microbiology in Europe. So today we're joined by Andreas Hoefer from here at ECDC and Rita Figuera from DG SANTE. So Rita, before we begin, could you just explain a little bit about what DG SANTE is?
Of course. DG SANTE is essentially the part of the European Commission that works on health and food safety. The official title is the Directorate General for Health and Food Safety of the European Commission. So we play a role in many areas linked to health, such as protecting and improving the public health across the EU. We develop a lot of health policies, including legislation, and we ensure coordination between the member states in this area. There's also many colleagues working on food safety and animal and plant health. So in short, in DG SANTE, we just help to build a healthier and safer Europe through our work here, hopefully.
Okay, good. So we're going to be talking about EU reference labs today. What exactly are these?
EU reference labs, that we also call the EURLs, they exist in various sectors like food safety, medical devices, or public health. So these are labs that we select at the EU level, so this is done by the European Commission, for their expertise in a certain topic. So their job is essentially to support the national labs in the member states to improve the work that they do and to allow collaboration between the countries. So the objective is to help all of the countries to align their ways of working so that they can meet the best lab standards possible.
And so what is new about this in the public health area?
Well, the European Commission has just designated the first 9 EU reference labs in 2024. So these are all dedicated to different areas of public health, for example, antimicrobial resistance, or they may be dedicated to specific groups of pathogenic bacteria or viruses according to certain characteristics. So each EU reference lab is made up of a partnership of leading public health laboratories.
Okay, so Andreas, how do these EURLs for public health work?
The EURLs are going to be able to do this in a number of different ways. They're going to be working directly with the national laboratories to help them investigate any public health threats that we have, any pathogens that are of particular concern to us. They do this by providing technical advice to the laboratories at the national level. They'll do laboratory capacity building, so they'll help make sure that the standards are as high as possible. And they coordinate different procedures, such as quality assurance and important aspects like that. The ultimate purpose here is to make sure that the tests being done in the laboratories in the national level are as consistent and reliable as possible, so that when we do encounter one of these public health threats, everybody in Europe has a strong laboratory capacity to respond to that.
You mentioned quality assurance there. Is it fair to think of that as a sort of pop quiz for the lab itself? So that you see national labs ensure that their methods are consistently accurate?
Yeah, that's actually exactly right, Lee. So what we would do, for example, is one of the EURLs might take a number of different pathogens and they put them in a panel, and it's blind, so the labs don't know what's coming to them. They would send it to these laboratories, and then the EURL kind of looks at how well the national labs identify each one of those pathogens. And then we pool all of those results. And what we do there, it's not a pass-fail, or it's not an audit of sorts. What we do there is look for areas of improvement. So when the labs send the responses to these queries or to this pop quiz, as you said, We try to make sure that everybody is answering all the questions right, and then we can be sure that across Europe we have a strong response there.
Staying with you, Andreas, how do EURLs fit into ECDC's public health strategy?
Yeah, so I mean, the EURLs are going to be, or they already are since January, a very important part of Europe's kind of public health infrastructure, especially on the microbiology side. Like I said, the key here is to ensure consistent and comparable lab data across the countries that are working on this. And in order, like we do all of this in order to kind of ensure the effective disease surveillance and outbreak response. This is done by the key areas that I mentioned before. So this is the technical guidance that we provide, the quality assurance that we mentioned, and the capacity strengthening that we do. So one simple example for this would be, for example, if you have a salmonella outbreak somewhere, in order for us at ECDC to know the full extent of this, we need to make sure that the country that detects this outbreak and the neighboring countries are all looking for it in the same way and that they use the same laboratory procedures to do this. Only then can we be sure that we can fully assess the extent of the outbreak, and it helps us best respond to the situation.
You've mentioned capacity building a couple of times there. What does that look like in practice?
The capacity building is a very targeted thing. So I think many of the EURLs start by doing a gap analysis. So we look at what's done in the different countries and we's training in a face-to-face, anything that could maybe be improved. And then we design very tailored and targeted trainings for these countries so the participants can attend these training in a face-to-face visit. Sometimes the EURL will go to a country and will train staff on site. We also do webinars and everything so that we can kind of have the maximum impact from these capacity building activities. And it really is just to make sure that everybody in the national labs has kind of that highest standard to make sure we're doing the things the same way.
Rita, going back to you, what was the vision behind establishing the EURLs?
From a European Commission perspective, many health initiatives really came as a result of the COVID pandemic. Countries are stronger when we work together to detect health threats. As we often say here at the Commission, pathogens don't respect borders, as you can imagine. So under the banner of building a strong European Health Union, as it's called, the Commission launched a number of proposals, one being the new legislation that led to the creation of the EU Reference Labs for Public Health.
You mentioned the European Health Union there. Can you unpack that a little bit?
The European Health Union is about protecting the health of EU citizens. It's many actions that together will improve the way the EU and the member states can prevent and address future pandemics and generally improve the resilience of our European health systems.
So we've heard from the Commission's perspective about the establishment of the EURLs and the vision behind it. What's ECDC's perspective on this?
ECDC has a history of working very closely together with our national counterparts. So we've always been working kind of with these disease networks, as we call them, to not only kind of provide them with technical advice and guidance, but also to hear from our national counterparts what they need from us and how we can best help them. The EURLs are kind of an important playing piece in this field now, because they offer us an opportunity to kind of help coordinate and help guide these national laboratories in a more hands-on way. We still work with these networks that we've had before, but the EURLs are now a big part of this. And their function is going to be to help kind of guide and coordinate the activities of the national laboratories. They're going to strengthen the microbiological foundations that we spoke of before, and more than anything, help us to align the lab practices across Europe.
When you say strengthen the microbiological foundations, could you give an example of what that actually looks like for a patient, for example? Does it lead to a doctor being able to more quickly diagnose a rare infection, for instance?
So that's a great question. So I mean, in not every hospital has the capacity to perform every test. In a situation like this, a doctor would need to send that sample to a national reference lab. And the national reference lab would then be able to take a look at that and then either provide the local doctor with an answer. But in some situations, even they don't have the capacity, or maybe it's a pathogen that's not very common there, to give a firm answer to this doctor in the hospital seeing this patient. In situations like this, that national laboratory might reach out to an EURL EURL and confirm that the test that they've done was done in the right way, that their diagnosis is correct. And all of this can be done in a very, very fast way for the patient. And then the result that we get is sure, so that there's no misdiagnosis or any missed cases, for example.
So we've talked a lot about collaboration and about this sort of strengthening Europe's health response. Could you elaborate a little bit more on that?
So I think as we saw during the pandemic, there's with these major public health crises, especially the cross-border ones that are widespread, there's no single country that can handle these by themselves. So what we're going to do is the EURLs are going to bring expertise from across Europe together, from all these disease networks that we mentioned before, and use this joint expertise to kind of formulate and help support a good, strong, unified response here. This means that when there's a new public health threat, we're not going to be starting from scratch. We're going to have quick access to the national counterparts, to all the people that we need to be talking to in the countries, so that we can have a strong and appropriate response to public health events.
So you mentioned COVID there, and obviously it's in the back of our minds quite often here at ECDC. Could you give us more details of a real-world example?
Certainly. So during the COVID pandemic, the EURLs would have been very useful in supporting national laboratories by providing this technical guidance on diagnostic approaches and acting as a diagnostic reference setter. This would have helped ensure that at the time the testing was reliable and consistent across countries. So, I mean, if different countries are doing the testing in different ways, this would reflect in higher or lower numbers, and then it makes it really hard for us to compare what's actually happening across Europe. In a future pandemic, this is the exact kind of scenario where the EURLs would be relevant. For a new pathogen, the designated EURL would work immediately to start sharing best practices, to act as a reference point, and to provide quality control that we've mentioned a few times already. It's this behind-the-scenes work that the EURLs would be doing that would lead to a better surveillance, more accurate case detection, and a more coordinated response.
Since the reference labs that were launched at the beginning of this year in 2025, what are some of their immediate priorities? Are they already working on specific things?
Yeah, so I mean, I think from our side, after all the work that went into setting these up, it's super exciting to see, and I think Rita will agree, how much they've already produced. So, I mean, they're working on these gap analyses to see what different things can be improved in some countries. They're working on the EQAs, which is kind of the formal word for the quality assurance that we've been discussing as well. They've done country visits for capacity building. I mean, if you go to a conference nowadays, a microbiological or public health conference, you see the EURL logo popping up all over the place. So it's really, really impressive to see the amount of work they've done. They have a huge workload, so there's a lot more coming from them, and I think we're both very excited to see what they're going to continue to do there.
Rita, so how do laboratories get involved during a new health threat?
Well, when there's a new health threat, the national authorities alert the EURLs, and then the EURLs, in close collaboration with us at DG SANTE and also with ECDC, they can be mobilized to support the response. So they may provide, for example, some technical guidance or coordinate reference diagnostics or help interpret some complex lab data. So their role is to ensure that countries have the tools and the expertise that they need to be able to respond quickly and effectively.
Andreas, would you like to add anything?
Yeah, I think Rita covered it perfectly. But I mean, I think from ECDC side, what the EURLs will help us do is they'll help us bring us closer to the national laboratories, so that in these situations they can help us with the technical advice that Rita mentioned. They can help us assess laboratory readiness in the area and anything else that we can focus on to again best mount our response to a public health threat.
Rita, how does a lab become a EURL?
Well, to become an EURL, this involves a formal designation process. So the labs must demonstrate, of course, their scientific excellence, that they have the right technical capacity, and the ability to collaborate at the EU level. So once they're designated, they take on this leadership role, so supporting other laboratories and contributing to EU-wide initiatives and helping to implement public health strategies. So it's essentially a recognition of their expertise and a commitment to serving the wider European community.
Andreas, at a more sort of technical level, how is information shared during a crisis?
So that's a very interesting question and a really important one. Information is shared in multiple levels during a crisis. So there's very high level kind of formal means of communication. It's one of our systems that we have is the Early Warning Response System, EWRS, which is very formal. And then we have other levels that are more kind of technical. So we have another thing that's called EpiPulse. It's been referred to as kind of the Facebook for public health. And the EURLs are going to have access to that, or they have access to this. And this is one of the platforms that they can use to help provide direct response and technical guidance to a member state or to a national laboratory that is facing some kind of public health crisis. The key here, again, is that we're going to be working from ECDC, from SANTE. We're going to be working very, very closely with the EURLs and in turn with the disease networks so that we have a very open and transparent information sharing throughout the entire process.
Rita, what sort of challenges do the EURLs face?
Well, I'd like to start by saying, as Andreas was saying earlier, that how impressed I am, in fact, with everything that the URL has already started. But of course, there are challenges ahead. And one challenge will be to keep pace with the evolving public health needs and technologies. The URLs really need to stay ahead of the emerging threats and maintain these high standards of expertise.
When you speak of emerging threats that labs need to stay ahead of, are you thinking of things like new viruses, the effects of climate change, on disease spread, or something else?
Well, it could be all of that. It could be the threats that we already know. It could be something similar to the last pandemic that we had. But we also know that climate change is bringing new challenges. Because with it, we have diseases that were not typically in our EU countries and are becoming more prevalent. So, and we also have what we call unknown threats. So it could be new pathogens, it could be a variety of things.
Okay, is there anything you'd like to add to that?
I think Rita covered it very, very well. I think anytime you're shifting from kind of a system that we previously had, these historic disease networks that we've worked with for a very long time, and you introduce a new player, it's just important to make sure that we get everything right so that we can continue to do exactly what Rita said. So far, it's been fantastic. There have been some lessons learned on the way. And I think in every round, because every year now, we're going to be implementing more EURLs. We just want to make sure that all of them get a smooth start so that they can start working effectively as the first 6 has done.
You said getting it right there. What does getting it right look like?
So, I mean, for me, getting it right, and Rita, please jump in. For me, getting it right is making sure that we reach exactly the right people and we address exactly the right topics, because it's very easy to kind of get into a routine and to continue doing the same things. But we want to be a little bit dynamic with this. When we identify a gap in the needs or a gap in laboratory training, we want to find that gap and then specifically tailor those trainings to make sure that every country is getting the most out of these EURLs.
Rita, what does the future look like for the EURLs?
Well, the future is looking bright. Looking ahead, the URLs, I hope, will play an even more strategic role in public health, that they'll really be central to our capacity for early warning, for providing references. So really, we want their expertise to be key to tackling future health crises.
Yeah, exactly. And I mean, the only thing I would add to that is that I think the EURLs, with all of their activities, they're going to be a very recognizable player in the field of public health microbiology. So you're going to see the logo, you're going to see their websites and everything that they have there. And then you know that you're working with a center of excellence. You're working with one of our designated EURLs, and what they kind of produce is something that we can trust.
So for my final question today, Rita, what would you say the key takeaways for our listeners should be?
I would like our listeners to know that behind every reliable test result, every coordinated outbreak response, and every piece of trusted data, there is this network of dedicated labs that are working to protect our public health across Europe.
Yeah, I mean, there's three things here. There's the collaboration, the consistency, and the scientific excellence that I think the EURLs are going to help bring closer to all of the national laboratories across Europe, and we're very excited to continue to work with them.
Rita, it was very nice to have you joining us for this discussion today. Andreas as well. Thank you very much both, and have a good day.
Thank you. Have a good day as well. Bye.
Thanks a lot, Lee, and I hope it was interesting for your listeners.
Thank you. We hope you enjoyed this episode. If you'd like to know more about ECDC's work with the EURLs, please see the notes of this episode. If you'd like to know more about ECDC in general, please visit ecdc.europa.eu or follow us on social media. If you enjoyed this podcast, please give us a like or follow us on a platform of your choice. And don't forget to leave a comment and a review.